Hey y'all, my name is Dr. Andy Buisson. I am here today to just discuss a little bit about hearing loss and tinnitus. Let's start with a common misconception. A lot of times people with tinnitus think that they have tinnitus and that it's affecting their hearing. It's actually the other way around. So when people have a hearing loss, a lot of times, usually I want to say about 80% of the time, they also experience tinnitus. Tinnitus is a symptom of hearing loss. So what tinnitus is it's the brain's way of filling in the gaps. When we have a hearing loss, our brain is so used to hearing all the sounds, the speech sounds, ambient noises, environmental noises. It's so used to hearing all those sounds perfect. So when we have a hearing loss and the brain is missing that signal or that stimulation or sounds in general, then it wants to go searching for it. When it goes out searching for it, it actually disrupts the anatomy and how sound is processed in the ear. So what happens is the brain's search for the stimulation that it's missing pops up and is represented as tinnitus. Tinnitus is any sound, whether it's buzzing, ringing, orchestras, voices, any sound that you can hear that other people outside can't hear. Like I mentioned earlier, tinnitus is a symptom of hearing loss. If we were to fix the hearing loss, then it helps reduce the perception of the tinnitus. Usually the one way to really fix a hearing loss, specifically a sensory neural hearing loss, would be with hearing aids. What the hearing aids do for the tinnitus is it brings up the hearing loss to be able to hear at a normal level. Therefore, it reduces the brain's need to search for the missing signal. First thing that we're going to do is try hearing aids. That is going to help improve your hearing and in turn hopefully reduce the perception of tinnitus. Tinnitus truly is only bothersome, what we would classify as bothersome, when it becomes an emotional link. So a lot of times people with tinnitus, what happens is they perceive it as something that is never ending, something that you can't get away, you can't control. When those thoughts are manifested into emotional responses where anxiety comes up, depression comes up, that's when the tinnitus truly becomes bothersome, and that is when we try a different method of intervention. So there are more in-depth treatment options that can help for more intense cases of tinnitus, that being linear. In a later video, we will talk about the specifics of linear, so stay tuned for that. But another intervention that we like to approach tinnitus with would be therapy, right? Counseling. A lot of times it's paired with the linear treatment to help the anatomical emotional response, but also the mental emotional response. So there are a lot of different approaches and interventions that can really help patients with tinnitus, because tinnitus, I always say it, is a very individualized thing, right? People experience it at different times, they experience it in different ways, how it starts up, how it manifests and perceives for the patient. So definitely talk to your audiologist and see what treatments they have. So whether the treatment you need is hearing aids, linear, or in-house therapy, we offer all of it here at Western Colorado Hearing. So definitely reach out, let us know what you're interested in, and we'll kind of decide how to approach your individualistic needs.